早晨嚇，今日係
Good morning, members. This is the last meeting of the Establishment Subcommittee in this year. We have one item to discuss today. Before the meeting, the administration submitted an information paper, ECI 2023-2410, for member circulation. The paper sets out the latest changes in the directorate establishment approved since 2002 and the changes to the directorate establishment in relation to the item on the agenda. I remind members that in accordance with Rule 83A of the Rules of Procedure, members should disclose the nature of any direct or indirect pecuniary interest relating to the item under discussion at the meeting before they speak on the item. I also draw members' attention to Rule 84 on voting in case of direct pecuniary interest. Before I invite the public officers to brief us on the item, I'll have Mr. Aaron Liu, Deputy Secretary, who wished to clarify something, or Mrs. Angelina Cheng. Thank you. Today's item is in relation to the proposal to make permanent of a time-limited post of Assistant Director of Social Welfare in the Social Welfare Department, SWD. As you know, some will call these time-limited posts as supernumerary posts, and that has caused some misunderstanding. Some believe that with these time-limited posts, they may count outside the establishment, but that is not the case. As explained before, the supernumerary post means that it is not a permanent post only. So starting from this occasion, we wish to avoid any confusion. That's why we call it a time-limited supernumerary post. And for the first time in a paper, we mention this as a time-limited supernumerary post, because outside of this, we've always called this supernumerary post. For the first time in this paper, we'll call this a time-limited supernumerary post, and we have a note in this paper to talk about this, and from now on, we'll say it is a time-limited supernumerary post, so that there is no confusion as to whether time-limited posts are counted outside the establishment, because that will not be counted outside the establishment. Now, this proposal is about making permanent of a time-limited supernumerary post of Assistant Director of Social Welfare, ADSWD2, in the SWD with effect from 23rd of April 2024, or with immediate effect upon approval of the Finance Committee, whichever is the later, to continue to provide dedicated directorate support in the regulation and monitoring of residential care homes for the elderly, RCHEs, and residential care homes for persons with disabilities, RCHDs, childcare centers, CCCs, and drug-dependent persons treatment and rehabilitation centers, DTRC, so as to enhance their service quality. Public officers in attendance include Mr. Ho Kai-ming, Undersecretary for Labor and Welfare, Ms. Wang Yin-yi, Deputy Director of Social Welfare Administration, and Ms. Nancy Kwan, Assistant Director of Social Welfare Licensing and Regulation. For those who wish to speak, please press the Request to Speak button. Well, there are quite a lot of members who have pressed the Request to Speak button. I'll read out the order. Mr. Rock Chen, Mr. Kenneth Leung, Mr. Chao Su Chong, Professor Chen Wing Kwong, Mr. Lai Tong Kwok, Dr. Chao Man Kwong, Mr. Chen Hai Leung, Dr. So Cheng Wing, Mr. Kingsley Wong, Mr. Tony Zhe, Mr. Lee Chen Kung, Mr. Chen Yong, Ms. Lillian Kwok, and Mr. Stephen Ho. Let's not waste any time. We won't have the Undersecretary explain the item. We'll start with questions right away. Mr. Rock Chen, please. As we all know, the government has quite a tight budget. That's why we as LegCo members have to be prudent when considering proposals. Now, the department is proposing to make permanent of a time-limited supernumerary post to a permanent post. So have you considered, as an alternative option, adopt more technologies or have the position absorbed by other assistant directors so as to enhance efficiency, and that would make the post no longer necessary? Have you adopted such measures to avoid making permanent this time-limited supernumerary post? Undersecretary, please. Well, I'll give a brief response and then I'll let the Deputy Director give supplementary information. Well, this post was first created in 2017 for the licensing and regulation of residential care homes, RCHs, and centers. It has quite a heavy workload. As you may know, the related incidents took place in 2017, and after that we have strengthened licensing and regulation, and we have not seen such incidents happen since 2017. And this post was renewed in 2021. And we consider it necessary to make this post permanent because this work is ongoing and there is an increasing demand for the licensing and regulation. In fact, it is after several years that we will implement the new ordinance. So we really need this post for the tasks involved. I hope that members will support this proposal as a result. Deputy Director, anything to add? Well, thank you. In relation to the regulation of RCHEs and RCHDs, before they were taken up by the two assistant directors involved, that is Assistant Director Elderly and Assistant Director in Disability Services. Now, this is quite a heavy workload for this position. And the two original Assistant Directors had their own duties. If they have to deal with the additional workload of the Assistant Director Licensing and Regulations ADRR, it would not be possible. So we hope that members can support this proposal of making permanent this time-limited supernumerary post. Any follow-up? None. Well, members, excuse me, I forgot to report on the deliberations of the panel of by the chairman of the panel. So let me first talk about that. The panel on welfare services discussed during the meeting on 16th of October 2023 the proposal. While the majority of members supported enhancing work in the aforementioned areas, they raised a number of points. It was said that monitoring and regulation should be strengthened so as to ensure service quality. It was also said that risk management should be enhanced to identify and deal with early on abusive behavior and exploitation of imported care workers. It was queried whether some of the duties of the ADSW post overlapped with those of directorate staff in other branches of the SWD. Some members objected to the proposal, stressing that the government's cost-cutting measures had a significant impact on subvented NGOs, and suggested that the government should tide over the difficult times together with the welfare sector. The administration was also requested to provide the long-term plans and objectives of the AD post for the work of monitoring and regulation to justify the proposal. The administration advised that each branch had its own distinctive duties and tasks. One of the duties of the ADRL LR was to train, mentor, and guide the staff of the licensing and regulation branch, LR branch, with a view to enhancing their knowledge and skills in respect of licensing and regulation of RCHs. The administration also explained that the cost-saving program aimed to realign priorities to enhance efficiency and achieve cost-saving targets without affecting daily operations and public services. In addition, the LR branch has implemented and will continue to roll out a number of measures, including stepping up inspections, implementing various service quality and staff training programs, setting up an information website, and actively taking forward the relevant statutory requirements under the Residential Care Homes Legislation Miscellaneous Amendments Bill 2022. With a rapidly aging population, there is a growing demand for elderly and rehabilitation services. Long-term monitoring and regulation of RCHs and centers are therefore crucial to safeguard the well-being of residents and users. Excuse me, sorry about that. Let's continue. The next member to speak would be Mr. Kenneth Leung. Thank you, Chair. I have several questions. I can see that the establishment, or at least the duties for the ADLR, included the supervision of the Kowloon City and Yaochunmong District Social Welfare Office. Is it the case that the time-limited supernumerary post already deals with that? In that case, why are we putting this permanent duty in the purview of the time-limited supernumerary post? Do you understand what I'm saying? I want to understand the logic that the administration had with the workload or with the duties of the post. In relation to the regulation of centers, I can see that there are 83 childcare centers, CCCs, and I can see that there are 20 odd advisory letters or written directions issued. So there are approximately 4 homes at least, that 4 centers at least, that needs to improve their performance. So how can this post ensure that these warning letters or advisory letters are indeed addressed upon? I'll let the Deputy Director answer this question. Thank you. For the ADLR post, it has to supervise the Kowloon City and Yaochunmong District Social Welfare Office. It is just the administration arrangement of the SWD. For other assistant directors, apart from their main duties, they also have to supervise some district social welfare offices. So in 2017, when we created the time-limited post of ADLR, we have assigned the Kowloon City and Yaochunmong District Social Welfare Office to be supervised by the ADLR. Well, with district social welfare offices, it would involve engaging stakeholders in the district, or they also have to coordinate with other service units. So we would require someone with their professional expertise, such as a commissioner or an assistant director, to supervise these district social welfare offices. In relation to inspection matters, I'll let the assistant director answer that. Well, assistant director, please. Thank you. In the paper, it was said that some warning letters have been issued to child care centers. The warning letters or advisory centers include daycare centers for children as well as CCCs. So it's not just the CCCs. After we have issued warning letters, we will adopt a risk-based approach and step up inspections. And when inspections are carried out, we would see whether CCCs have improved in relation to the items that we required them to improve. their performance on. If they have improved their performance, then that would be all right. If not, we may take further action. For example, we may issue a written direction, or we may take other enforcement action. That's it for what I have to say. Thank you.
Madam Chair, I'd like to follow up. The administration hasn't answered me yet. For the district social welfare officer in Yaotimong and Kowloon City, well, they haven't yet explained the nature of this position. I still don't understand the logic. Let me supplement. Thank you, Madam Chair. Why is it the case that the supernumerary position oversees a regular permanent post? Actually, the assistant director oversees district social welfare offices. There are a total of 16 districts. Usually, each one of the assistant directors will oversee 2 district social welfare offices. So for this supernumerary position, the position holder also oversees 1 district social welfare office. Not all colleagues are capable of being this position holder, given the nature of this position. Next, Mr. Chao Siu-chung. With an aging population, I believe there will be a burgeoning demand for elderly care services. And the amendments to the residential care homes ordinance have been passed. I do agree that there will be more and more supervisory burden and duties, and we do have to improve the services in this regard. So I do not object to the regularization of a time-limited supernumerary position. In 2017, the SWD created this position, followed by a restructuring, hence the branch of licensing and regulation. I don't see any improvement in the supervision and regulation aspect. Back then, there was an incident that took place in children's residential home, exposing some loopholes. The regulation regime leaves much to be desired. The manning ratio is insufficient. After the inspection of the SWD, any improvement? Well, I think that the SWD is definitely aware of the problem. We are running a manpower shortage. The care workers are actually snowed under. The SWD is actually turning a blind eye to the situation. They think that when they are strict with the regulation, maybe the elderly will have to be homeless. They will have to live on the streets. The SWD simply turns a blind eye to the situation. Then how can we fare better in relation to supervision? In the long run, do you have any planning about supervision? You have to give confidence to the public. After the regularization of this time-limited position, we will supervise better. You need to give confidence to the public. Regarding my next point, there will be 7,000 imported workers in the industry. I am concerned whether the local workers will be exploited, such as the deduction of wages and so on. These are covered in media reports from time to time, and I believe those being exposed are only the tip of the iceberg. These cause an impact on the quality of residential care homes for the elderly. Does the administration have any concrete measures that have been put in place? In paragraph 10 of the papers, that is on the review of the manpower for healthcare services, I'd like to know the progress. For the manpower, I will invite the SWD to take it. Regarding the performance indicators, after the creation of this post, well, I think that there has been a decrease in the number of cases in society. The situation mentioned by member is more common in private residential care homes. There may be different reasons, one of which is a manpower crunch. There are 3,000 to 4,000 imported workers working in this industry, and the ceiling has been relaxed to 7,000 in total after the introduction of the special scheme. So how can we provide better services to the elderly? On the importation of workers, we have imposed regulations. Under the lead of the Assistant Director, we have been making the requirements clearer. That is, we do have requirements about which mainland organizations or counterparts are eligible to import workers or to export workers to Hong Kong. We have also commissioned NGOs to help in case of any breach of the rights. Then the workers can report these matters to them in order to safeguard their rights. Next, Professor Chen Wen-Kwong. I agree the making permanent of one-time limited supernumerary position of Assistant Director of Social Welfare in order to enhance service quality. I have a couple of questions for follow-up. One, after we have made permanent of one-time limited supernumerary position of the Assistant Director of Social Welfare, is there any target, such as the number of complaints? Will there be any decrease in the number of complaints? Any improvement of service quality? If yes, what are the details? Overseeing residential care homes is under the purview of the Assistant Director Licensing and Regulation, but then, in our experience, cases in relation to abuse of the users of the RCH were exposed only because of the public, and the harm and trauma will be permanent scars on the children or elderly people affected. So I'd like to know, when we make permanent of one-time limited supernumerary position, will we see any enhancement of guarding against abuse? For example, any mechanism or any points mechanism, or will we deregister the workers in order to prevent similar accidents from happening? In annexes or enclosure 3 to 4, I'm aware that elderly residential services are covered. I'd like to know from the administration the division of work in relation to the enhancement of elderly care services, so that there would not be any duplication of duties or resources. Regarding the question about KPI, I will invite the Assistant Director to take this question. Regarding the service quality, time will prove. This position has been created since 2017. Indeed, there has been a decrease in the number of such cases. Before the movie was put to screen, that incident actually happened before 2017. So we can see an increase or an enhancement of the service quality of residential care homes. This will bring benefits to the public and society at large. Deputy Director, There are a couple of assistant directors, such as elderly services, rehabilitation and medical social services. Actually, these three assistant directors work closely with each other. And the assistant director on rehabilitation and medical social services work on planning development of the services, including residential care homes, community support, and care support, which is close to our heart. The assistant director is responsible for the development and implementation of these aspects, whereas the assistant director, licensing and regulation, is responsible for the management, regulation, licensing of the residential care homes. The assistant director oversees these issues for unannounced checks, complaints about care, or any serious breaches. For the prosecutions of this kind, these will be under the purview of the assistant director, licensing and regulation. But these three assistant directors work very closely with each other on a daily basis. And they do combine forces to handle any complaints about residential care homes. Looking ahead, we will regulate residential care homes better. There are over 1,000 or so residential care homes. We will do better in terms of licensing and regulation, enhance the service quality. We will continue to pursue an enhancement of the service quality. The residential care homes ordinance has been amended, so we will take action accordingly, such as demanding racial operators' responsibilities, registration scheme of superintendents. We have a series of duties that require the lead on the assistant director, licensing and regulation. This position also needs to collaborate with the industry. Next, on the manpower for healthcare services, it already started in July. It is expected that by the end of next year, the review will have been completed. After that, I reckon there are quite a lot of duties to be followed up on, such as the creation of the post-senior healthcare worker, and as I mentioned, the review committee will continue to work on this connection, and the assistant director will continue to monitor this issue. Next, Mr. Lai Tong-kwok. The government is having tight financial resources. So, I believe members will agree that we do have an important responsibility in examining each and every application of the creation of directorates positions. Regarding this proposal, I have given due consideration to it, and I agree to regularize these time-limited supernumerary positions. Licensing and regulation is no easy task, especially when we have just now passed the residential care homes legislation bill. So we want the SWD to do better in terms of the monitoring and supervision of RCHs in order to enhance their service quality. If, however, we vote this funding proposal down, then SWD will be in dire straits in rising to the challenges ahead. Rising to the challenges ahead. At the same time, the Legislative Council is scrutinizing a bill on a mandatory reporting of child abuse. the bill is complicated. If it is passed, the SWD plays a very important role. In other words, the SWD will have a lot of duties under its purview, and a directorate is required to spearhead different duties. Can the administration tell us, when you make permanent of this time-limited supernumerary position, in the future when it comes to the reporting of child abuse cases, will you deploy the resources within the SWD instead of coming to the LegCo once again to request the creation of one irregular post?
Chair, we do not have any plans to create another post to deal with the work of the mandatory reporting of child abuse. We have 5 branches, main branches in the SWD. Apart from the elderly branch, we do not have any branches specifically for children's welfare. We do have a family and child welfare branch, as well as a branch for rehabilitation and medical social services, and children's services are allocated under the several branches. And upon discussion, apart from the elderly branch, we believe all other branches would have to get involved in relation to the work on the mandatory reporting of child abuse. So the whole social welfare department will deal with the additional workload. As mentioned in the policy address, in 2024, we will have an emergency child care center, and we will have an additional center, and we will have 400 additional places a year. And with the increase in strengthening of foster care services, we believe that the additional workload can be dealt with. So we do not have any plans to ask for another post to be created. Thank you. I have follow-up, Chair. Well, I hope that in future there won't be any changes. Now, we already have the bill of mandatory reporting of child abuse being discussed. I believe the department already has their estimates as to whether their resources are adequate. So is it the case that unless there are unforeseen circumstances, the words of the Undersecretary essentially amounts to a promise that there won't be any posts created for the additional workload? Well, as Mr. Lai said, unless there are drastic changes in circumstances, we do not see the need for a post to be created. Well, yes, unless there are unforeseen circumstances. Thank you. Next, Dr. Chow Kong, please. I heard what the Undersecretary said, and I think we really have to be prudent with the creation of posts. With 2017, this post was created to strengthen licensing and regulation of RCHs and centers. I can see that there are thousands of inspections, and I can see that 162 were eventually convicted. So we really have to consider whether there is indeed a need for this position to be created. And I can see that you have approximately 162 people in your establishment. Will you need more non-directorate officers? If you are not, how will you alleviate the pressure on manpower shortage? I can see that from what you answered other members, you have other assistant directors that will supervise district social welfare offices. Why is it that only some of them have to do that? And I think we really have to strengthen support for RCHs and centers during the pandemic. There may be insufficient anti-epidemic goods, but it is very important to maintain hygiene in RCHs and child care centers. Will the department or bureau consider setting up more KPIs to maintain the hygiene of RCHs and centers? Thank you, Chair. Well, I'll let the department provide information on the specific figures, but in relation to the KPIs, we will not set, for example, the deregistration of RCHs as a KPI. But I do think with this position created in 2017, since then we have seen an improvement or enhancement in performance of RCHs and centers. Of course, there's always room for improvement, but we'll tackle the issues one by one. So, in relation to why certain assistant directors are not required to supervise district social welfare officers, in fact, as you may know, though one responsible for the planning and development branch is in fact an executive officer, so they may not be qualified to supervise district social welfare offices. And there is another branch for the disbursement of financial assistance. We think this director really has to focus on their work in particular with much of the financial aspects of things. So we'll have the existing other assistant directors supervise the district social welfare offices. And Deputy Director, please answer the question about figures. As we said, we have conducted 5,000 odd and 2,000 odd inspections with RCHs and centers. Apart from the increase in the number of inspections, we have also conducted more in-depth inspections. We have taken a targeted approach. We have dedicated teams to carry out inspections, and all of these inspections are unannounced. When we have received complaints, we will conduct in-depth investigations as well as inspections should we identify any irregularities. Depending on the seriousness, sometimes we will issue advisory letters, sometimes we'll issue warning letters. If warning letters are issued, we'll follow up on those. We'll invite them to propose a plan for improvement or rectification, and we really have to make sure they have put some measures in place to rectify the mistakes. And we may instigate prosecution if the problems are not rectified. But lately we have seen homes and centers, they have really improved their service quality, and they've really implemented measures to rectify their mistakes. Apart from legislation, we have also implemented other measures to improve service quality, including providing training to staff members, and we have really provided training to carers to make sure the ones that they care for are indeed cared for. So we have really tried to enhance the staff members' knowledge and skills. Thank you. Well, I think the administration is not answering my questions at all. They are just going round and round. That's just what I want to say on record. Thank you. Next, Mr. Shanghai Long, please. In relation to this proposal, I have 3 points to make. I can see that the manpower establishment is not that large in the social welfare department, so with the creation of posts, of the making permanent of this one post, it's not ridiculous, so to speak. And I think there is a heavy workload to be dealt with by the social welfare department. Also, this post, if it lapses in April of next year without any renewal or making permanent, I don't see any way that the department can deal with the extra workload. That's why I support this proposal. Like Mr. Rock Chen, I think we have put in place much funds to make permanent this post, and this post is supposed to regulate RCH centers as well as various other work. I think this is not possible to be done by one person alone. That's why I think the department should adopt more technologies. With the outrageous incidents that took place before, and with incidents recurring every now and then, can, with our inspections alone, enough? That's why I think the department really has to think about formulating monitoring measures that can make sure there are no blind spots. If you can make use of technology such as AI to strengthen monitoring, that would be ideal. I can see that AI or technology is being adopted elsewhere with the monitoring of homes, but I do not see any such measures mentioned in the paper. I hope that the administration would consider that. Thank you. Who's going to answer that question? Well, I'll first give a brief response, and then I'll see if the deputy director has anything to add. In relation to monitoring, we have funds that can disburse financial assistance for that, and with the monitoring of CCCs, we have the innovative office of the government to develop a CCTV with AI function. I believe the report will be published next month. And in fact, some advanced tech companies such as IBM is currently developing CCTV that has such function, and that is what they are doing at the moment. And we will have a meeting with CCCs next month to see if we can do so. If this is feasible, we will see if we can roll it out to other RCHs. Deputy Director, anything to add? Thank you. Well, as said by the Undersecretary, next month we'll have a meeting with residential childcare centers on the latest developments of the inner office. So whether it's RCHEs or RCHDs, we encourage them to use technologies. And with the rehabilitation application fund, private RCHs can apply to the fund to enhance their management, for example, in the disbursement of dispensing of drugs. They can make use of AI in doing such work. It should alleviate the burden of staff members, and it can also enhance service quality. Thank you.
Next, Dr. So Chang-Wing. Thank you, Madam Chair. For the incident that happened in children's residential home, 34 staff members were prosecuted. 15 of them have been convicted. So we have seen this situation. The residential care homes legislation bill was then introduced. The administration said that the regulation could be enhanced, so there is no reason whatsoever that I'm not going to support your funding proposal. But after reading your papers, I find some points rather interesting. You're saying that we have to make permanent these time-limited supernumerary positions. I'd like to know what long-term plans you have. I don't see any from you. Did the time-limited supernumerary position not stand to work? Was it not helpful? I'd like the administration to reply. Dr. So mentioned if this position is not created, then the situation will be kind of restored to 2017. That is, the portfolio will be overseen by other assistant directors on other issues or on other aspects. We do want to save public money, but the difficulty lies in the fact that some new services are already under their purview, such as issues relating to carers and the planning of GBA RCHs. They are also under the purview of Assistant Director Elderly Services. If these assistant directors have to be responsible for local RCH as well, then I'm afraid they will be snowed under, much as they'd like to help. So we want to supervise and regulate the local RCHs in order to enhance their quality. Indeed, we have already considered other proposals in order to save public money. At present, this funding proposal is actually the best one for us to take forward our projects and initiatives. Any follow-up? So, were the time-limited supernumerary positions not helpful at all? Well, we see an enhancement in the service quality. And in 2021, we renewed this position. We don't want to come to the LegCo once again to apply for an extension of this position. We do need a directorate to take forward these projects and enhance the service quality, especially when it comes to the licensing requirements for 8 years after the passing of the residential care homes legislation bill. We do have the resolve to enhance the service quality of local RCHs. Any follow-up? Dr. So, any follow-up? If no, then next one. Kingsley Wong. Mr. Kingsley Wong, please. I also agreed to make permanent this time-limited supernumerary position. Citizens may not know the RCH very well, so the burden is on the government to monitor RCHs better. We do take a result-oriented approach. In order to enhance the service quality of RCH, as members mentioned, like Mr. Chao Siu Chung, Under these circumstances, maybe 2 workers are actually bearing the burden of 3 workers. There are also examples of exploitation of the rights of workers. An unfavorable working environment would definitely take its toll on the service quality of RCH. So will the SWD include breaches or irregularities under the licensing requirements? In serious cases, maybe these RCH can be deregistered. I'd also like to know, among the 699 warning letters, was there any instance in which the rights of the workers were exploited, thus warning letters were sent? We also need to enhance accountability of RCHs. What concrete measures do you have? Undersecretary, for the first 2 questions, I will invite the SWD to answer them. Regarding accountability, in the Residential Care Homes Legislation Bill, we already requested that the RCHs have to be registered. We have already provided courses for them to enhance their quality, so we have both carrot approach. Well, I mean, most of them actually started their career as a care worker or a healthcare assistant. Some workers cannot register if they have any breaching of the law. So we put in place a carrot and stick approach, and the assistant director will be responsible for taking forward this law and, well, I mean, the implementation of this law. Regarding the issue mentioned by member, we have a licensing office for various RCHs. We do have teams of inspectors. One of them is a social worker inspector. We conduct surprise checks to inspect the day-to-day operational documents in detail, including the attendance record of the staff, employment contract of the staff, and we will also check their identity cards and count the numbers. Members also question the need for us to check the identity card, but we are actually being very serious. We check on the spot whether there are any false identity cards or proof of documents, and whenever there is any irregularity, we call the police for follow-up. We do have a minimum staffing requirement. If there is a shortfall in the number of healthcare workers and carers, we will instigate prosecutions. We will also send warning letters telling them there is a manpower shortage or there are not enough workers. If there is no improvement, we will instigate prosecutions. We need the RCH to meet the licensing requirements. Any follow-up? For the convicted workers exploiting RCH residents, will the government impose restrictions on RCHs so that RCHs will operate in a lawful manner instead of exploiting workers to make money? Will the SWD consider this? Thank you, Madam Chair. We will review the situation later. And we will also check the quality of the RCHs. But of course, we have heeded members' concerns. Next, Mr. Tong Ni-tae. Thank you, Madam Chair. Because of a heavier burden and a wider coverage, members like me are also in favor of the creation of the post. as I mentioned, you need to tell us the performances of this position so that we can assess whether this position holder has actually achieved the intended results. We don't want to see problems arising from this position and then you are coming to the electrical yet again to ask for the creation of position. Regarding this position, in enclosure 1, the responsibilities are contained on that page, but I believe this position is sustainable. There is continuity. But you also need key performance indicators in phases. Otherwise, people will not be satisfied with the progress. And then you will come to the lecture again, complaining about the manpower shortfall. Madam Chair, we have already met with the industry. The licensing and operation of RCHs. We emphasize regulation, but what about implementation? We haven't yet seen any results. Previously, you encouraged the provision of RCH on private properties or on private land, mainly through the special scheme of using private land to build social welfare offices, and you also took $20 billion to purchase private properties to provide such facilities. In the past, we have seen these initiatives, but we actually don't know the results. We saw the groundbreaking ceremony of Port Oil Hospital. Services will be provided starting 2027. But have you paid attention to the time in the run-up to the start of the services? How much time was spent in preparing for the provision of services? Elderly care services leave much to be desired. But regarding this position, I'd like the Undersecretary to tell us, have you set any KPIs or phased KPIs regarding the work of this position? Apart from this position, there are 2 other positions having overlap duties, such as RCHEs and other social welfare facilities. Undersecretary, please. Thank you, Mr. Tony Tay. Thank you for completing the scrutiny of the bill last year in the Bills Committee. The bill has been passed, but it will only come into effect next year. There will be more changes. The legislation has been amended, and some private RCHs will have to think how they can improve the quality, otherwise they will be made to fold. What about the carrot? What kind of carrot do we have to offer to these private property? We have a special site schemes. But in the policy address last year, 5% of public housing development will be used as residential care homes. This will be a great incentive to build more residential care homes for better operation. So, in the carrot and stick approach, we want to encourage the industry to go forward. Once again, for our KPIs, we do want to work on something that will improve the quality of the RCHs. The fact that there have been fewer such cases. It's a bad example showing the effectiveness of our work. Mr. Lee Chen-keung.
Thank you, Chair. I can see that the proposal is to make permanent of a time-limited supernumerary post, and in turn, the service quality for services ranging from 3 years old to 80-odd years old will be covered. I have reservations about this proposal, both me and my members of my political party, the Liberal Party. I think we really have to think about whether a single department should be handling such work. With an aging population, is it the case that one single person can resolve all the issues involved? I think that is a question mark. So with this time-limited supernumerary post in place, there are still incidents in RCHEs. And you are now saying that you want to make this post permanent instead of renewing the post every now and then. How can members of electrical monitor your performance? Why can't you just renew this post for another 5 years? Or if you say you need 8 years to complete the tasks, and then I can just allow you this post to lapse after 8 years. Why don't we do that instead? We have a manpower shortage in RCHEs, and there is insufficient training provided to staff members of RCHs. I think that is an ongoing problem. This is a persistent problem and consistent struggle. Can we perhaps put in place some career pathways or professional recognition so that staff members of RCHs would have upward mobility? Thank you. Undersecretary, please. I think what Mr. Lee Chen-keung said was quite correct. There may indeed be friction between the administration, the government, and staff members of RCHs and centers. And they may ask why we are being so strict with their performance. But I think with patrolling stepped up, there are indeed less irregularities and service quality is indeed enhanced. And I think we are still taking a lead compared to other Greater Bay Area cities in terms of the provision of elderly services or services for other service users. I believe we can export our operational model and talents to other cities if necessary, but this is not the main point that I'm saying, but it indeed protects the interests of the trade. I do understand Mr. Lee's dissatisfaction, but I think this is what is right to do in terms of the strengthening of monitoring. Well, Chair, I have a follow-up. I do not see how this post indeed improves the performance of the trade. In what aspects? I do not see that specifically. If you have KPIs in place or if you have a roadmap and then you make this post permanent, that would be justified. If you're proposing to make permanent this post now, there is no way for electrical members to monitor the performance of the work of this post. Thank you, Chair. Well, I think when this time-limited post was created in 2017. Well, actually, ever since then, we haven't seen any large-scale incidents that have taken place. I think this demonstrates that there is indeed an enhancement of service quality in Hong Kong. With an aging population, we need to make sure we can provide better services for the public. Thank you. Next, Mr. Chen Yong. So my concern is not just about the department. I do understand this is the general direction to take to have more people in the department to deal with the additional workload. But I think we need more frontline officers to carry out inspections. I can see that there are 154 cases and there are in total 809 RCHEs. We really need more frontline officers to carry out inspections more frequently. If we have a flatter structure and we have more frontline officers, would that be more effective? You really should consider whether to increase directorate officers or the number of non-directorate officers. And you also have to think about, with the making permanent of this post, how you can guarantee that effective work is indeed carried out. We may have high levels there with this post being made permanent, but are there enough frontline officers to carry out such work? Can you tell us your justifications or elaborate on your proposal for that? Thank you. I'll let the Deputy Director answer that. Thank you. We are proposing to make permanent this time-limited supernumerary post. And this ADSW post provides high-level steering as well as formulation of policies. It will also lead the LR branch. It has 160 staff members to carry out the work mentioned earlier, for example, step-up inspections, and to provide professional training that are QF recognized, to enhance awareness of staff members. So the post would provide more high-level steering. We have also increased the number of frontline officers for each inspector. They would be responsible for a reasonable number of RCHs and centers. And lastly, after the Committee on Review of Childcare and Related Services, the recommendation was that we should strengthen monitoring. And we are glad that in 2023-24 we'll have an additional inspector for centers, and we will also have an additional officer as a registered nurse that can provide better support to the section. Anything to add? No? Thank you. Next, Ms. Lillian Kuo. Thank you, Chair. As said by other members, I do not see any long-term planning. I can see that the workload is administrative in nature of the post. Of course, if you can strengthen monitoring, service quality should be enhanced. With the new legislation in place, we do want to improve the living environment of RCHs, and that's why the post was created then. I thought it reasonable, but as I heard earlier, you will carry out inspections and you'll check the identity cards of RCH staff members. So that is a compliance check, so to speak. But in terms of the enhancement of service quality, is it the case that the services branches will not deal with the enhancements of service quality? Is it only responsible by the LR branch? And other members have asked about long-term planning of the department. I can see that with the scope of work, you already have a planning and development branch, and you have an assistant director in that post. I can see that other posts in other departments, there are posts for D2. For the assistant director in transport department, they also deal with licensing. I believe they're dealing with more numbers of licenses in their workload. They also deal with various other work, such as safety, enforcement, prosecutions, and so on. So from what I read, I can see that there are 700 RCHDs, and there are 20 childcare centers, and there are 166 children's homes, and so on. And there may be other licensing matters that you have to deal with. How many renewal applications do you have to process each year, or is it the case that it will only be renewed every 3 years? And should there be this deregistration? How many new homes are there every year? I do not see any figures, and I've asked the department to provide the relevant information to me, but I have yet to see anyone from the department make contact with me. Thank you. Well, Ms. Kwok, thank you. Well, in relation to licensing, it is important to make sure there is compliance with statutory requirements. So it's not just about granting licenses, we need regular inspections. So some in the trade have asked before, why are we conducting inspections so frequently? And this is exactly the point, because we need to ensure there is compliance with statutory requirements. For example, with the milk that elderly persons are consuming, we have to make sure they are not expired. So that is one part of it. We need routine control to enhance service quality and to maintain our current service standards. I'll let the Deputy Director answer the rest of the questions. Well, I believe what Ms. Kwok said was specifically about the granting of licenses. We have 4 teams, including social workers, health inspectors, as well as building and fire safety personnel. We have to make sure all the statutory requirements are complied with before we grant a license. For RCHEs and RCHDs, their licenses will be renewed every 1 to 3 years. And regarding whether their license will be renewed, we'll look at their past performance, whether they have complied with our quality standards, if warning letters have been issued before or irregularities have been identified. We may shorten the time for renewals to be made, thereby strengthening monitoring. And every time we renew a license, just like with the granting of license, we have to make sure all aspects, including hygiene and monitoring and management and so on, are indeed well maintained. As I said earlier, the assistant directors are working closely together. For example, the planning and development branch works specifically on provision of places for various services and development of such services. For the Assistant Director on Rehabilitation and Medical Social Welfare Services, they also focus on their work in that area specifically. And with the regulation, renewal of licenses and granting and complaints to be dealt with, they are all managed by the AZLR. So it has quite a heavy workload, this post. As for some service enhancement schemes, for example, we have been providing QF training courses for various workers and staff members of RCHs of different QF levels. By providing such training, we hope to equip staff members with the necessary skills. We have also strengthened monitoring in the sense that we have increased transparency in relation to warnings issued to RCHs. So these are what we have been doing in recent years. We also have a registration scheme for health workers. The vetting of such applications is also handled by the LR branch. With the residential care homes legislation bill coming into effect in this year, the work to take forward the statutory requirements is also handled by the LR branch. So for a permanent D2 post, that is quite an appropriate workload. Thank you.
Madam Chair, well, a couple of my questions are left unanswered. Can I follow up on them, or can I ask them later on? Next, Mr. Stephen Ho. Well, will there be any great enhancement after the creation of this post? Well, the fact is, no, there wouldn't be any. This position is already present right now. We already have this position. As Mr. Tunite mentioned, 3 years ago, you came to make an application. So, I mean, what you did yesterday would not be vastly different from what you do today. So, any enhancement in the services would not be completed just because of this position alone. Well, I hope you will clarify this. Madam Chair, as I said many times, the papers provided by the administration in Establishment Committee are not very good, especially when it comes to paragraph 3. Many points were actually just copied from the policy address. So not just your department, when you come to the Establishment Committee, please focus on the duties of the position. Don't just copy all the points from the policy address. Please provide a new paragraph on the responsibilities and duties of the position. Children's residential homes are mentioned, but you actually didn't deregister the children's residential homes. It's a very rare case. As Mr. Chow mentioned, you have a lot of concerns which limits what you can do. I believe you also have regard to the supply in general. I'd like to ask, do you also oversee the conduct of the RCH in considering the licensing of the RCH? You buy places, there are also private places, and there is a price differential. Some people use, so to speak, legal method. Well, actually, some people are overcharging. This will also affect some elderly people. They just can't buy the places. When there needs to be an assessment, there is a delay. So, I mean, there are conduct issues. Do you ever consider conduct issues in the licensing of RCH? Of course, this position is already present. We do have this position right now. It is a time-limited supernumerary position. Will there be a drastic enhancement in the quality? No, I don't believe so. But ever since the creation of this position, it's been 6 years, and we have seen an enhancement of the service quality, which speaks volumes about the importance of this position. We are worried if the licensing and regulation issues are overseen by other bureaus like in the past. We are worried about any possible issues. According to the policy, those buying places will have to accommodate elderly people getting a place through the central allocation system. If some people breach our regulation, that is, they receive government subsidies, then we will take action. Well, can you improve your papers? Just focus on the responsibilities of the new position. Just a brief answer, a quick answer. Well, I don't think member is just asking about our papers. Well, just tell me your answer about your department, your bureau. When the development bureau comes, I will once again ask them. Well, my position is that I will not be against your proposal. I will endorse it to the finance committee. But you do need to improve your papers and tell me any solution. Next, Mr. Benson Lok. Members have mentioned that the government is having tight financial resources. We do have to consider whether it is value for money. The licensing and regulation branch is responsible for monitoring residential care homes, taking legal action, and strengthening training and professionalization of the staff in residential care homes. But in paragraph 4 and 5 of the papers on the number of visits from 2017 to 18 to 2022 to 23, the licensing and regulation branch conducted an annual average of 5,577 inspections. That is 3 inspections every day on average. In paragraph 4, there are 809 RCHEs in Hong Kong. If we have to complete an inspection cycle, it takes some 270 days to complete one visit. If so, then the visits are very infrequent, and I don't think members of the public will be satisfied. So my question is that from a time-limited supernumerary position to a regular permanent position, can we increase the frequency of the inspections in order to enhance the quality of RCHs? Thank you, Madam Chair. I will invite the Deputy Director to take this question. Regarding members' concerns about inspections, I'd like to let you know that we have 4 teams of inspectors overseeing different aspects. So it is a comprehensive monitoring regime. We have inspectors of social workers, they check managerial issues, manpower, or any complaints lodged by the service users or their family members, attendance records. And we also have inspectors who are nurses. They mainly go to rehabilitation services, such as the dressing of the wound, personal hygiene, drug management, meal management, etc. For building and fire safety, they also oversee this aspect. The industry actually told us that the inspectors are around for a long time. Yes, indeed, the inspections took probably more than 1 day. It's also a kind of risk management. If there are irregularities, we will conduct more frequent and in-depth inspections. This is our strategic move. After 2017, inspections took the form of teams. That is, we have inspectors, retired discipline services professionals. They carry out inspections together. We don't just drop by the residential care homes and leave it like that. No, we don't do so. We carry out comprehensive inspections and identify any irregularities and room for improvement. Aside from regular inspections, when we receive complaints, we also conduct surprise checks on the residential care homes immediately to check the follow-up of the complaints. Any follow-up? If no, next member please. Mr. Holden Chow. Thank you, Madam Chair. I was also involved in some complaints where the family members of some service users complain about the standard of service. For this position, that is to make permanent a supernumerary position, I believe members agree or understand that you need to do it. We are not against it. If you need to turn it into a permanent position, we are not against it. But despite successful cases, we still cannot overlook the fact that some organizations or bodies have unfortunate events, such as children's residential homes. We do see such cases. Members also mention what we fear the most is that in the management of the licensing regime, the assistant director is responsible for monitoring the licensing regime. You send advisory letters, warning letters, written directions, and you also conduct inspections. But, in some cases, the administration may not be able to control all residential care homes. The administration is hamstrung in this regard. I think members are thinking along this line. If we are to make permanent of this time-limited supernumerary position, then who is there to deal with the situation? You need to show the institutions that have breached the regulations that you will not be bound by a lot of concerns. You will be bold enough to take action. Other organizations may think that they are too important to be controlled. Some large organizations have a great many staffers and service users. So if you have a lot of concerns, it will be difficult for you to tackle the situation. Well, I think you should take bolder moves to control the situation. This is my opinion. Thank you.
Undersecretary, please. Thank you. Well, the incident that took place in children's residential home is definitely unfortunate. But we have worked with various stakeholders to conduct a two-stage review. We have 31 and 39 recommendations in the two phases, and we are implementing measures in relation to the recommendations. For some RCHEs, for the incidents reported in the news, we have dealt with them, but now that we have experiences under our belt, we know what to do. We won't allow for elderly homes closing, causing much trouble and confusion for elderly service users. We will have accommodating measures after elderly homes have closed down, perhaps after they have deregistered, to cater for the needs of elderly service users. And as I said earlier, there are assistant directors that are working together, and that should promote the development of the sector. Chair, I have a follow-up. They may have an existing mechanism in place, but when it comes to, say, third-party platform that intervenes in serious incidents, it may help you with exercising your authorities. As I said, if necessary, a third party should intervene. Well, we have 5 other members who will speak for the first round and a member who will speak for the second round. Any other members who wish to ask questions, because I may draw the line here, even without that we may have to extend the meeting. So for those who wish to ask questions, please press the request to speak button. We hope to deal with this item, the discussion of this item today. Next, Dr. Loai Kwok, please. Well, the proposal is to make permanent of a time-limited supernumerary post of ADSW. It provides support in the regulation and monitoring of RCHs and centers to enhance service quality. The work is definitely important. The service users are often disadvantaged, for example, young children who are unable to care for themselves, as well as persons with disabilities. We really require staff members to provide the best possible care to them, but now we often see abusive behavior. In previous incidents, we see a group of staff members abusing the service users. How can the public not be angered by this? We see such incidents recurring every now and then, and that is indeed quite regrettable. That's why I believe certain members today can't help but support this proposal, because this is definitely an ongoing task. And as I mentioned before, how can this post be time limited. This is an ongoing task. And other members said there should be KPIs set, and I agree, because if without KPIs, you may have people who are performing well that are not rewarded, and those who are performing average constantly asking for resources. So I think the administration really has to do well to make sure the public would not make any complaints while such complaints are indeed reasonable. I can see that before, during Tun Festival in some small RCHEs, they want to distribute the rice dumplings, and they only have 3-story homes, and if they have 2 village houses, that is already quite ideal for their residential care homes. The one that I went to has only 1 village home that is 3-story high, and the elderly persons won't leave their homes because it's hard to transport them. It is very rare that they can go outside. While the staff members were very dedicated, they did not have adequate resources to do that. I asked the administration to build more elderly homes, or at least improve the environment of existing homes. I think the administration really has to deploy more resources in terms of the hardware of residential care homes. Undersecretary, please. I'll let the Deputy Director answer the question about residential CCCs. And as said in last year's policy address, an additional 5% of gross floor area will be provided for welfare premises. And it is expected that in 2025-26 more welfare premises can be provided. And in future, with these small LCHs, we hope that we can relocate these facilities to public housing projects in future, because with these smaller homes, they have a smaller staff. We will continue to liaise with them to see if we can relocate these small homes. These small homes are not sustainable anyway, and their floor area is quite small, so we think they're not sustainable. I'll let the Deputy Director answer the question about RCCCs. In relation to residential childcare centers, over the past year, we've implemented multiple measures against them. We have stepped up random inspections. We have social workers step up inspection, and we have provided additional training to enhance the awareness of the staff members. When carrying out inspections, as I said earlier, they are now more in-depth. We will also monitor various aspects such as the behavior of children to see how they respond to the staff members' actions. We have also installed CCTVs, and we have asked the operators to strengthen management of their staff members to ensure service quality. And we have dedicated guidelines for residential childcare centers, and we have distributed such guidelines to all operators. We have also strengthened communication with NGOs. last year, we have set up the service quality group. It has 60-odd members, including JPs and some district leaders, as well as those in the relevant social welfare and education sectors. They have conducted visits to centers to recommend any improvement measures. After the children's residential home incident, we have 18 youth service workers who have been convicted, and 13 of such workers have been deregistered. 5 of them, we are following up on them at the moment. Next, Ms. Yong Ho Yan, please. Thank you, Chair. I can see that the paper has 16 pages, and in 2017, when the position was created, there were 25 pages. It includes various duties provided by the AD in relation to stepping up inspections and providing training, and so on. So regarding this paper, whether it's the number of inspections, they've only provided figures on that, and I am quite dissatisfied with that. From 2017, 18, or 22, 23, you've conducted thousands of inspections. But what is the trend? Is there an increasing number of inspections being carried out? Is the assistant director performing well? There are no indicators to measure the performance of the assistant director. And from what I can see, the main duties and responsibilities and the indicators set for the assistant director are essentially the same as those provided in 2017. So essentially, the duties are essentially the same. Why is there the need to make permanent the posts now if they are the same as those in 2017? When you established the AR branch, you had your plans that the non-directorate officers would be helping to carry out the work. So now that the guidelines have been set, why is there a need for this assistant director? Are you only having this assistant director to monitor the work of frontline officers? Well, when you created this time limited post, it's mainly to set out the guidelines, and you have proposed multiple measures. For example, what Mr. Stephen Ho said about improving the block place scheme and enhancing service quality, providing training to registered nurses, as well as dealing with certain subsidy schemes. I do not see in the paper what you've done in recent years and any additional justifications for making permanent this post. I can see that in paragraph 5, you said that there is a heavier workload these days, but this is the case with every department. So when the post was first created and with your proposal to make permanent, the main duties are still the same. I think the proposal is not justified. So can you explain why the main duties are similar or the same as those in 2017?
In the job description, it serves as a framework. Members are aware of the Residential Care Homes Legislation Miscellaneous Amendments Bill. So there are new duties that become statutory duties. apart from the amendment of the residential care homes legislation bill, which makes it more complicated, the update of the registration scheme, especially those, the scheme for health workers, this also imposes a heavier burden on our colleagues. So I'm not going to supplement on the improved quality as a result of the more frequent inspections. Well, Madam Chair, I don't think the administration is showing enough sincerity. Of course, the children's residential home is indeed abhorrent. It is indeed abominable. You said that you have already done it, or you have already dealt with the situation, but in the papers, I don't see any. We have already reported our work in the working group. So the 31 and 39 measures are being implemented, and I will explain to the Council in due course. Well, Madam Chair, it's an establishment subcommittee meeting, and I do want to see your progress and what you have done in the ESC papers. I don't want to access this information through other papers. You need to do more to convince us to support your funding proposal so that you can make permanent a time-limited supernumerary position. Next, Ms. Carmen Can. In EC 2023-24-10, well, from for a time-limited supernumerary position, you have to return to the subcommittee. What promises do you have? This title gives us a lot of aspirations. We have high hopes. These papers are submitted to the ESC for consideration. So, this paper should serve as a comprehensive report to show us your grounds. The Chief Executive takes a result-oriented approach. Can you undertake or give us a pledge that there won't be any children abuse or elderly abuse in the future? Regulation is key. To have a regime with the GBA, will it be undertaken by the SWD or will it be undertaken by the LWB? Your title reminds us of that. For the interface of standard, that is important. Can the administration respond in this regard? We are working closely with the counterpart in the Guangdong province. We will sign some service agreement to foster more cooperation in order to give Hong Kong citizens more choices. Our standards are compatible, but we will adopt a cooperation mode so that Hong Kong citizens can enjoy the services in the GBA. This gives members of the public more choices. Well, Madam Chair, I'm concerned about the interfacing mechanism, and of course the mainland has their own standards, and you just cannot overstep the line. But when it comes to the interfacing of the standards, Is it under the purview of this Assistant Director Licensing and Regulation? Well, that is the local statutory issue. These issues are relevant, but it will not be directly under the purview of the Assistant Director Licensing and Regulation. When we make permanent the Assistant Director for the work in the future, as I mentioned, there are a couple of fronts: regulation, monitoring, enhancement of quality, and implementing the residential care homes legislation bill. In relation to how to implement these 8 areas, this will be the major responsibilities of the AD licensing and regulation. Well, we take a result-oriented approach. Can you say that we can eradicate elderly and children abuse? Well, I cannot say for sure there wouldn't be any, but then in any unfortunate event, we will regulate and monitor the situation. We don't want to see any similar situations. But the fact is that in the prevailing situation, these occurrences are actually very rare. It's 10:21 right now. In order to have sufficient time to discuss this agenda item, I will extend the meeting by 15 minutes. Next, Mr. Dennis Leung. Thank you, Madam Chair. For the monitoring of the RCC, residential care homes, RCH, CCC, and so on, to make permanent this supernumerary position, it is necessary. You should have come earlier. You shouldn't be applying just now. In the papers, the Assistant Director, AD, has various responsibilities. In the papers, it is said that this position is necessary. Well, that is the case whenever you come to the establishment subcommittee. But members would like to see the future development and action agenda of this position. How can you improve the service? How do you solve any possible future issues? We want to see more of these areas so that we will know the government does have the resolve to do so. In the past, residential care homes for the elderly had a manpower crunch. We needed to import workers, and we will continue to do so. But I fail to see under the purview of the AD any monitoring of the imported workers. Under the LWB, there are 2 limbs, one SWD, the other Labor Department. But I do want to see the imported workers working in residential care homes being protected. They shouldn't be exploited. After the amendment to the residential care home legislation bill, we want to see clearer career development to allow more participation of local citizens on training, qualifications. These issues are not covered in the papers either. In the future, can the administration tell us more clearly the responsibilities so that members of the public will see that the government has the resolve to address the issues that are close to our heart? Thank you, Mr. Dennis Leung. One, on the manpower of RCHs, we do want to have more locals joining this industry. There is a working group on the review of the residential care homes manpower. In the future, we look forward to a better grade structure of health workers. For example, where possibly in the future there will be the position or rank as senior health workers. For the local workers of RCH, we do want to see enhancements in the future. Deputy Director, please. Thank you, Madam Chair. In the past few years, any areas for improvements for RCH? Since the establishment of Licensing and Regulation Branch, it took them 2 years to complete the review. Through the Working Group on Review of Ordinances and Codes of Practice for RCH, they reviewed various areas, identifying room for improvement. A lot of recommendations have been made. In January 2020, the Codes of Practices for residential care homes have been compiled. And for example, on legislative amendment, the Residential Care Home Legislation Miscellaneous Amendments Bill 2022 was completed. For the minimum staffing requirement, floor area, accountability, registration scheme for health workers and home managers, and the increase in penalty, these have been made the focuses of our responsibilities. And the AD licensing and regulation will be responsible for taking forward all these initiatives. Next, Mr. Tang Fei. To make permanent this supernumerary position, this is understandable, especially given the heavy burden and the regulations spanning 8 areas, over 1,200 or so RCH of different sorts. Members have already said that the burden is very heavy. It is not that easy to conduct an inspection. With an aging population which is irreversible, the elderly need more and more care. Just one single case of elderly abuse will already shock society, especially in a Chinese society. We have great respect for the elderly. Well, it is of course impossible that we can eradicate all these cases, but the fact is that one single case of this sort will already shake our confidence. This will also have an impact on society. The administration has a clear monitoring and regulation regime, but the point is, who is there to supervise the regulator? To make permanent this supernumerary position, what will the regulation be? The burden is indeed very heavy. Should you also tell us the KPI of this position to be made permanent? This position will be bound by a contract if it is a supernumerary position, but when we have made permanent this position, it is a different story. It will be more difficult to regulate or monitor this post. Can you clarify the situation for us? Under Secretary, please. We will, from time to time, report our progress to the Legislative Council. When we made permanent this supernumerary position, as we mentioned, it is ongoing work. Regarding the implementation of legislation, we will only conduct more frequent inspections, especially after the enactment of the new legislation. Does it mean that the position will not be monitored by the Legislative Council or ESC? From time to time, we come to the Legislative Council, and I'm happy to discuss with members the issues in relation to the review of RCH. Any follow-up?
All right. Next, speaking for the second round, Ms. Lillian Kwok. Thank you, Chair. As I said earlier, the administration did not answer my questions in relation to the regulation, that is LR branch and the other branches. What is the distribution of work with the carrying out of inspections? And with the additional places provided, it would be handled by the services branch. But is it also relevant to the licensing? I actually observed some provision of elderly service at NGOs. With the scope of service, we would often report. I can see that they will often report to the elderly services branch or the children's branch. So I just want to clarify the distribution of work. And I want to know about the changes with the homes. Are there any new homes every year? How many are there? And would there be relocation of homes? Would the work be divided by branches? I think the administration really has to clarify that. I'll let the Deputy Director answer this. Thank you, Chair. In relation to the work of the LR branch and elderly branch and the rehabilitation and medical social services branch, the distribution of work is quite clear. With the shortage of places, as for which organizations to invite, it will be the elderly branch that is responsible for that. And once the home is constructed, with the granting of licenses, that will be handled by the LR branch. And after licenses have been granted, the inspections will be carried out by the LR branch. They have to make sure the homes comply with the statutory requirements as well as the requirements in the codes of practice. So that distribution is quite clear. And that is the same with RCHDs. Regarding the renewal of licenses, as I said earlier, we have 4 teams looking at different aspects. And for every inspection, we have to make sure they have complied with all the relevant requirements before renewing their licenses. We will look at their past performance, and as I said earlier, if they have been issued with advisory or warning letters, we'll shorten the renewal period so as to strengthen monitoring and to make sure they have rectified the mistakes. Well, Chair, I have to follow up. They haven't answered me about the complaints and part. And regarding the service quality aspect of things, is it handled by the elderly branch or is it the LR branch that will be responsible for that? Well, in fact, as said in the paper, we have provided some training programs for staff members, and we have provided subsidies to encourage homes to have their staff members take such training courses. These courses will equip the staff members with the necessary skills, and that is what we have been doing. Well, I've drawn the line there, and that's all for members' questions. And now put to the item to vote. Members in favor of the proposal in EC 2023-2413, please raise your hands. All right. Members against the proposal, please raise your hands. Well, one of them I believe most of the members who voted on the item were in favor of the proposal. The proposal is endorsed. Now, on to the next question on whether there should be further discussion of the item EC 2023-2413 by the Finance Committee. No. The question is, the subcommittee recommends further discussion by the Finance Committee of the proposal in EC 2023-2413 that was endorsed by this subcommittee. I remind members that if this question is agreed to, it means that the Establishment Subcommittee recommends that the Finance Committee further discuss this item. If the question is negative, it means that the subcommittee does not recommend further discussion of the item by the Finance Committee. Do any members claim a deficient? Ms. Kwok, are you claiming a deficient? Are you claiming a deficient? Oh, well, I do not claim a deficient. There's no need for that. Okay, so none of members claim a deficient. Will members in favor of the question please raise your hands? Those in favor of the question will be recommending further discussion, so please raise your hands. We'll take a count. Okay. For members against the question, please raise your hands. Six. I believe most of the members who voted on the item were against the question. I think the ratio was about 6-5. The question is negative. That is, the subcommittee does not recommend further discussion of item EC 2023-2413 by the Finance Committee. This is the end of the meeting. I would like to thank all members for participating in the work of this subcommittee in this year. This is the last meeting of the subcommittee in this year. Thank you again for your participation, and the next meeting will be held next year. Well, now that the legislative year starts in January. Thank you.